Hello everyone. Today we are here with Mr. Avinav Nigam, founder, CEO of TERN Group. Hi, Mr. Nigam. How are you?
Hi, lovely to meet you. Thank you.
So coming to my first question, can you start by giving us an overview of TERN Group, its mission, both by AI-driven solution, and what differentiate your workforce infrastructure platform in the healthcare sector?
Of course. Thank you. It's very important to talk about the reason why we are building Turn. It all started, I was building my own investments platform in the UK when, in fact, a friend of mine, she ended up getting cancer in London. She went through 5 months of chemotherapy. She beat the cancer, but the NHS was short of nurses. They were short of workers. So she was asked to leave the hospital system and go into social care. She did not get the support there because not enough workers, so she was sent home. So for 10 weeks, she almost had no support. Because of that, she lost her life when the cancer came back. And to me, this became a personal mission to basically try and fix a very broken system. At the same time, we had a nanny in London from Gujarat, from India, who's an operating theatre nurse. She wanted a job in the UK in the NHS, but she found an agent, had to pay the guy lots and lots of money, almost 50 lakh rupees, right? $65,000 to get a job in the UK, which was fake job. So I think the problem in manpower management globally in healthcare is very broken. It's a very exploitative industry. So we said, look, what we're going to do is we're going to build a full stack workforce platform that does everything from recruitment to licensing support to the actual assessment of internal employees, everything on AI. That's how Turn started.
TERN's AI-powered healthcare workforce platform is being showcased at WHX. What are the key capabilities of this platform that you believe will most benefit the healthcare system facing? Hello.
This platform, as you can see in the back, the nursing workforce agent, the idea is really to take away the effort from the clinicians, from the doctors, from the nurses, from the HR teams, to really focus on what they do best, which is delivery of care. And all of the work that is around, processing of resumes, managing the documentation, the visa, the interviewing, all of that essentially should be done by AI, right? That's really one of the core capabilities is recruitment, both domestic and overseas. For example, the Emirates Health Services, we are long-term collaborators with, we've rolled it out across the entire system, all the Northern Emirates, they are using it to hire hundreds of people and interviewing thousands of candidates through the process. The other one that we built 9 other agents that are involved in leadership coaching, career development, skill development, mental health support for staff members, as well as ensuring there is enough understanding about capacity planning across the National Emirates Health Service. So we really believe if used correctly, this can 100x the amount of impact we can create as collaboration with human and AI.
In what specific way have healthcare system or provider seen measurable improvement, such as reduced hiring timelines or better retention after integrating your AI product?
So there's a few important metrics to consider, right? One is, of course, the time to hire. Time to hire in the case of traditional recruitment can take, especially for international recruitment, can take up to 2 to 3 months because you don't know what agencies are going to support, where they're going to get the data, who is the CV coming from. In our case, we've already proven the timing has compressed to 72 hours. Within 72 hours, over 500 candidates for one particular role were interviewed, screened over the weekend when nobody's working. And on Monday, the top 6 candidates were presented to the recruiter, for the HR, for them for hire. As an example, that's one. The other side of it we find is retention is a big challenge. People really do not stay in those jobs because these are very hard jobs to do. This is a new country you're coming to. You don't speak the language. You don't understand the culture. You may not be a good fit. So a lot of time is actually spent in our recruitment process with AI now on understanding the fitment to the role. So you have the person's CV, you also have the job description, but also the cultural understanding of what's required in that particular role. So we're investigating the behavioral aspects, we're investigating the technical aspects, and we're investigating also the cultural aspects of that individual. So 92% retention rate is what we are seeing wherever our products have been rolled out. For example, the UK, for example, in Germany, and now in the UAE, 92% retention rate after almost 2 years of being in the job, which compared to the category where 30% people leave, right, which means 70%, is extremely good as well. The cost of recruitment comes down significantly as well because the amount of money you invest into hiring somebody, training them, and the hundreds of people that are going through the process and the hundreds of hours of clinician time going in is all removed and eliminated. So that is almost invaluable, but one can say per role, you might be saving anywhere between 50 to 100K dollars.
So, like, what kind of response you have received for your products? And could you like share any partnership or collaboration within the healthcare practice?
So just to give you an example of our global presence, we work with over 100 healthcare systems right now. UK NHS, we are live with sort of various of the largest trusts in the UK. In Germany, 18 of the largest trusts. In Germany, we're live with almost 45 to 50 clients, right? All large sort of university clinics. Middle East, the actual launch for us actually been with the Emirates Health Services, where we've custom designed, custom built the full stack platform. So in other markets, we might just be doing recruitment. Here, we're doing everything from skilling, career development, leadership coaching, mental health for nurses, everything. This has never been done before, let alone by Tern. It has never been done in the world by anybody with a two-way sort of video interaction platform. So in the Middle East, we are in conversation with a lot of the private players, the main names you would probably know. We're live with a lot of them, more on the recruitment side, but the workforce setup, the full stack, this is the first time it's being launched, not just in the Middle East, not just in Dubai, but in the world.
So, how does TERN collaborate with the healthcare institution, government, and regulatory body in various regions to ensure your AI workforce tools support workforce continuity and compliance?
No, great question. So, look, we are government first. The way we operate is we make sure that from a regulation point of view, when it comes to AI policies, when it comes to GDPR, when it comes to nursing, for example, licensing or recognition processes, those are the processes that are pre-built. We have a team of doctors and nurses internally as part of the company that have been training the AI models that are part of the actual build out on the compliance and regulation side as well. I think for us, what is very clear is if we are able to make this work with the governments, which are the biggest investors and the biggest operators of healthcare in most of the countries, UK, Germany, UAE, Saudi, Qatar, where we're all operating, most of the healthcare is run, or a lot of the healthcare is run by the government. So we start only with government collaboration first, and then we sort of work into the execution mode. As an example, the former chairman of the NHS is an investment advisor in the company. The deputy health minister of the government of UK, right? One of the former health minister of a large Western European economy. They're all investors and advisors because they believe this problem has to be solved at an institutional level. It's not just to be solved on a one employer or a one job point of view.
Right. So, with TERN raising significant funding and expanding rapidly, what are your strategic priorities for next maybe 2 to 3 years?
Absolutely. So, great question. Look, I think we're now between Europe and Middle East, probably one of the fastest growing tech companies in healthcare. We believe, for example, in Western Europe, beyond our AI platform, because we were able to mobilize nurses from places like India, from Africa, from Southeast Asia, we were able to move them into markets like Germany, like UK, like Japan. We're specifically picking up Germany. We're actually looking at investing deeply into what is called hospital at home. So we're actually building the largest distributed healthcare provider in Western Europe. So think of it like a hospital, but without a physical building. So can you really do ICU at home? Can you do dialysis at home? Can you do rehabilitation at home? Can you do elderly care, palliative care at home? That's exactly what we've started to execute on. So we do around 250,000 visits. By the end of the year, we're doing around 2 million visits to people's homes to provide not just the basic care or long-term care, but actually the clinical and healthcare services also at home. And that is giving us a lot of the insights to keep building out the AI workforce platform for other regions. So from a location point of view, I think the Middle East is one of our most important markets. In fact, I've moved from the UK to Dubai last year because we believe there was so much possible. And as you can see, with the Emirates Health Services and our deep collaboration at a government and institutional level, we are now trying to roll this out across the region. The goal for us would be certain markets are key priority. UAE and Saudi are going to be one of the top priorities for us. Germany is another top priority for us. UK is a top priority from a demand perspective. From a supply perspective, India is one of our key strategic markets, South Asia, and North Africa, which is Jordan, Morocco, Tunisia, and Egypt.
Like you mentioned India, but India is still, coming to digital infrastructure. How do you plan to integrate your AI platform there?
Yes.
But there are like certain hospitals they are lacking digital.
Yes, absolutely agree. So, look, the way this works is we will probably not be rolling out the recruitment product, maybe in its own current avatar to the Indian ecosystem. We have to adapt it and localize it and work with the But actually, what we're finding is the governments. So the national, so I have an advisory role with the National Skilling Council, which is under the Ministry of Skills of India, Government of India. So I advise them on how to think about the next 65 million, 70 million people skilling, which is relevant for consumption of the labor within India, manpower within India, but also overseas. Now, the mission that, for example, Prime Minister Modi has is to make India the skill capital of the world, right? So we work with state governments in India. We have partnerships with almost 6 or 7 of them, where we're helping them figure out by building an AI layer to assess not just the technical competence of the nurse, but also the language competence. If they're going to Germany, they're going to UK, they're going to UAE, for example, in English, we also make sure that the fraud and issues around that are reduced. So a lot of the government side is very interested to take on our software solution, our AI solution, to also create a very high quality bar from a sending country point of view as well. So, but I think there's a lot that can be done within India specifically on upgrading of softwares. But reality is we say that, but to be very frank, India has actually accelerated quite a bit when it comes to digital payments with UPI, whether it comes to logistics, with the quick commerce. And we're seeing the same thing now happening in healthcare. So this is the moment in time where healthcare and AI is going to merge very, very quickly. It's actually one of the fastest growing industries in the world right now, which is AI investment in healthcare is outstripping most of the other sectors like fintech that used to have a lot more investment. So I think this is the future is happening here and it's happening now.
Right. I think that is all. Thank you so much for.
Amazing. Thank you so much. Really, really, really love you.